respond to your first comment that these people got big money. Yeah, I have been fighting the CEO salaries. In fact, on the Friday before, ma'am, I don't think it's
voluntarily. Nobody wants to.
No, I understand that, ma'am. People, well, no, I disagree. Ma'am, do you want me to respond or you want to keep talking?
You want the government to tell us we should take less. They did it on their own.
No, I don't, ma'am, and you're not listening.
You want CEOs? You want CEOs?
What the patients you gonna take care of tonight?
The answer is, first of all, when you say the government should stay out of it, we wouldn't have had Medicare, and I think that would be a great loss. Secondly, the administration has been trying to do what you are saying. How can I talk with you yelling? I'm trying to respond to her. I don't understand the mentality that thinks yelling like this is helpful. And all of you, I don't understand this. All of you interfere with a conversation. The point is this. Obama has met with the health insurance industry and the pharmaceuticals and the hospitals. I'm sorry, ma'am. Excuse me, that's what you said. You just said that he should meet with them and try to go. Right, I apologize. This is not a rational subject.
You didn't listen. I said the good people, not the special interests, not the AMA.
Well, yeah, in the hospital industry and in the industry. So, but the other point I want to make, you missed when you talked about the people in the private sector who got money from the financial rescue program. We have been tough on them, and I got a bill passed through the House on the Friday before we left to cut down substantially on the irresponsible bonuses they're getting. We will be curtailing top executive pay before the end of the year. And the only other thing I would do is, I don't want the government totally out of healthcare because I think it's Medicare and other things that go. And the Children's Health Insurance Program, for example, which I think is a very good one, which just passed, significantly reduced the number of uninsured children. Yes. Yes, ma'am, go ahead, you're Mike.
Yes. My name is Angela Woniker, and I'm here from Dartmouth, and thank you for coming out and sweating it out with us tonight. My question for you is, you said we would be allowed under this plan to have a public option as well as the private. I want to know how the private option will be able to compete with the public option when you have unlimited resources as with government money.
The bill says that the public option will get a $2 billion upfront appropriation for administrative costs, and thereafter will have to be break-even. There will be no subsidy amount from the Treasury. The advantage it will have will be that you won't have the profit making that goes to the shareholders of the private insurance companies. The offset will be that people say with the public option it'll be too restrictive, but there will be no ongoing federal subsidy of the public option. Oh man, you know what?
This is what will happen. People will be forced to take.
Okay, but here's
because let me ask you this.
no. When you ask me a question,
Your private insurance, are you going to be required to get government-run insurance?
no. Ma'am, I can tell you this. You asked me a question, I gave an answer to the bill. You say you don't believe it. Let me be honest with you. You came here believing what you want to believe. Nothing I say is going to have any influence. So what's the point? I mean, I told you what's in the bill. You don't want to believe it. Don't believe it. People are entitled to believe or disbelieve anything they want.
How are you going to pay?
Next question.
We're going to pay for it by raising taxes on Yes, we're going to raise taxes on corporations that are evading taxes overseas, and on people getting more than $425,000. And those of you who are the defenders of the people sending money overseas will fight it out before the Congress.
Hi, Mr. Frank. I'm a registered nurse, and I've worked in elder care for over 30 years. And elder care has been improving greatly over the past 30 years, and we do a lot in advanced care planning on an individual basis with people all the time. And I just wanted to say that for everyone here, if you would download on your computer pages 424 through 430, you'll get a feeling of what the advanced care planning consultation is all about. It says on here that an individual involved, if they've not had a consultation within 5 years, such consultation shall include the following. And they're advanced care planning directives. So I just think that everyone here should just do that and just see what they are. Now, also, a lot of us have been doing our homework. I know I've been trying to do my homework on this and going on the internet, and I've listened to people from the United Kingdom, from Norway, and from Canada. And I was recently listening to Dr. McCaw, who was very instrumental in not having this go forward before. And some of the agreement of all of these countries and the people representing them is that once this is put in place, the administration becomes extremely top-heavy. And once you're involved in all this, there's no way to turn around and get out of it. And they aren't happy in their countries with this. So that is one of my concerns. The other thing was Dr. McCaw said the way
You're running out of time.
Okay, the way this is going to be paid for is through, granted, half of it through raising taxes, and the other half through cutting Medicare by about $500 billion over the next 10 years, and yet there are about 30% of the population going into Medicare, into the enrollment of Medicare. So how this is going to be paid for is part of my question.
Okay, I'll respond. First of all, yes, people should read the advanced care that's about what happens at the end of life. It's all entirely voluntary, of course. But it's an added, all that this says is that your doctor can now get paid for it if you ask him to do it. That's what the planning for the end of life is. It is an entirely voluntary thing on the part of the individual. Many people now do it. Doctors can now not get paid for it. This would allow doctors to be paid for it. So that's what it says. It's not... That... it pays... If you want to get advice... If you want to get advice about how to plan what you want the people close to you to do at the end of life, you can get them the doctor, and the doctor will get paid for it. It's entirely voluntary. The doctor doesn't do anything. There's no medical treatments involved here. It's purely advice from the doctor. Secondly, as to paying for it, yeah, I am opposed to cutting Medicare that way, Medicare for hospitals, and many of us, they said on the Democratic side in the Massachusetts delegation, have been opposing that. I do have some differences with the way they plan to pay for it. I think those are going to be changed. Sir? No, I'm sorry, ma'am. You're really not being fair to other people.
Because she knows what she's talking about.
One last question.
I will be, and I own a business up in a business park. It's been in Massachusetts for the last 150 years. We currently have 100 dependents on our health care plan. It's 14% of our payroll. How do you expect us to compete with other companies if there's an 8% option for our competition? Okay? You worry about everybody keeping their taxes, their earnings overseas. There's a reason for it, sir. They're being taxed out of control over here. Consider doing what Australia just did. Australia just cut taxes on businesses doing less than $2 million by 50%, and cut the taxes on businesses doing less than $5 million annually by 30%.
Well,
this administration's done nothing for small business. 80% of Americans bank and help us out instead of taxing us into oblivion. And by the way, most of us are sub-S corporations. So when you say you're going to tax the rich, we fall into that category. Not because we take the money home, we leave it in our business to invest.
If you leave it... If you leave the money in the business, it won't be taxed. We're talking about what's taken out in personal. That's what the bill is going to do. I'm sorry, sir. Why is it when people get answers they don't like?
Human nature. People are angry.
Yeah.
Well, I understand they're angry. I don't understand why that means that they can't have a rational conversation. Anger and rationality shouldn't be opposites. The fact is that we are talking about only taxing that amount that's taken out of the business as personal profit. Secondly, when you say that nothing's been done for small business, true, in only a few months, but here's the point. Nothing has been done to raise taxes. You say all we're doing is raising taxes. Not a single tax has been raised under the Obama